episode of Memoir of a Naija Girl. My name is Helen. On today's episode, we'll be talking about mental health and mental illness. Mental health in Nigeria has been neglected. We don't give it enough openness, awareness, and importance like we should. 1 in 4 Nigerians, that is 50 million people, are suffering from some sort of mental illness, according to the World Health Organization. Nigeria has over 200 million people, and we only have 130 psychiatrists. Isn't that insane that in a country of 200 million people, we only have 130 psychiatrists? I think that is absolutely shaking, and that is very, very insane. Now, we have different types of mental illness. We have different types. We have anxiety disorder, we have personality disorder, we have eating disorder, actually, and many, many more. On today's episode, I have a psychiatrist who is Dr. Adetiloye. He's a senior medical practitioner in the Department of Psychiatry in Lasut, Ikeja. I'm going to put a call across to him right now because we can't get so much people in here because of COVID-19, guys. No one wants to leave their house. So I'm just going to call him right now. Stop that. Hello, good afternoon, Mr. Adetiloye.
Dr. Adetiloye.
Good afternoon, Dr. Adetiloye. Apologies for that. Welcome on Memoir of a Naija Girl.
Okay.
I'm happy you're joining us today. I have a few questions for you. On today's episode, we're just talking about mental illness and how we're not giving it enough awareness in Nigeria. So my first question is, how do we describe mental illness?
Yeah, thank you for having me. First of all, I would like to describe mental illness as a wide range of illnesses or psychiatric disorders that affect feeling, thinking, and behavior, thereby having a tendency to cause significant social and occupational distress or impairment of personal functioning. So this can be sudden, persistent, chronic, relapsing, and remitting. The World Health Organization noted that there are different types of mental disorder or mental illness with different presentations. Mental illness are categorized by a combination of abnormal thoughts, perceptions, emotions, behavior, and a relationship with others. There are various examples. You want me to mention a few?
Yes, I don't mind. You can mention a few, sir.
Yeah, you have depression, anxiety disorders, schizophrenia, bipolar affective disorder, etc., etc.
Because in Nigeria, I feel like we only talk about people when they're already in the marketplace. Like, oh, now this person is mad because they have gone berserk. I mean, we always talk about it when they've gone berserk. We don't give it enough awareness, and many families always keep their loved ones inside because they don't want them to be outside. They don't want people to know that they are suffering from mental illness.
Exactly.
Is there a cure for mental illness?
trigger this condition in already predisposed patient. Yes, and they are not curable.
Wow.
As a result of it, they are not curable, but they are treatable.
Wow.
Just like any other medical conditions like diabetes, hypertension.
Right.
We should take medication to control.
To control. So that means when you say they are treatable, that means they can be managed. Not they don't have a cure, but they can be managed.
Exactly, they can be managed.
Right.
And then with adherence to treatment, the patient could be stable and then function like any other normal person in the society.
So if we have someone who is struggling with their mental health, how can we help that person?
Well, in this public enlightenment,
right,
is very, very important. In order to help someone struggling with mental illness, right. Making them to be aware of signs, symptoms that are involved in mental illness. So public enlightenment will be in various levels, which I will mention.
Please do.
The early stage group. For example, in the children, because children are not fixed in ideas, they are flexible at this age. So they are not, they cannot be influenced by stigma.
Right.
So yes, they cannot be influenced by stigma. So once it's been taught at that level, show them signs and symptoms involved in mental illness, so they can easily come out.
To express themselves.
They can easily come out and present themselves to the appropriate place and at the appropriate time for treatment. Yes, and also the other levels are the religious organization,
right,
which should also be enlightened. The pastors, imam, the traditionalists, all these people should be enlightened, because the first place that people present to is to them.
Right.
People thinking that it's spiritual. It's diabolical. So that's the first place they will present to us. They waste a lot of time with them there, and symptoms become complicated before they get to us. So all these people should be enlightened in order to direct patients appropriately to the right place for appropriate treatment. Then also institution, that's another institution of learning at various levels, should also be enlightened. And then also the marketplaces, even to make the knowledge about mental illness didactic enough for them to understand. Even if it involves a local dialect, in order to make people to understand what mental illness really is, for them to present to the appropriate place on time for appropriate treatment. So enlightenment also can also be through social media generally. So nowadays people engage in various forms of social media, which is a very good means to enlighten people around.
Is there any sort of age bracket? Like, can children get mental illness? Can children have some sort of mental problem, or is it like it's just for older folks?
Well, it's rare for children to develop a mental illness.
Right.
It's rare for them to develop mental illness, although there are some conditions which we refer to as which refers to as a neurological or a developmental disorder, which usually happens around the age of, or noticeable around the age of maybe three upward. Things like autism, autism, ADHD, attention deficit and hyperactivity disorder, things like intellectual disability. So all this one can be noticeable around the age of 4 or 5. And basically that.
Why is the silence louder than the conversation when it comes to mental health and creating awareness in Nigeria?
Well, see, it is very, very important to let us know that stigma, stigma is a major factor in this
economy
area. Yes. So stigma in the sense that individually,
the Nigerian factor, guys. It's the Nigerian factor. So I'm going to drop and I'm going to call him back. Like the conversation when it comes to mental illness in Nigeria and creating awareness in Nigeria.
Yes. Well, the major issue in this aspect is the stigma. Yeah. If we go by way of the individual suffering from mental illness, stigma can be self-directed in the sense that a person suffering from mental illness may feel somehow restrained to go to the appropriate place. Due to fear of being labeled.
Right.
So by keeping the condition to itself and causing all form of distress. So now also the lack of awareness too. Lack of awareness of mental illness and then mental illiteracy, which is so common in this environment, can lead to people, keeping to themselves, and then believing that their symptoms are due to spiritual cause and not presenting at the right place and at the right time. So all these factors put together, they contribute to the silence
of this conversation,
of this condition. And then in the societal level, it's still about the awareness too, and then the mental illiteracy that is so common in our society. People lack knowledge about some significant symptoms of mental illness, and then they are misdirected as a result of this in terms of receiving a good care at the appropriate place. And then even among ourselves as a medical practitioner, and it's so funny that some of us don't even, they're not enlightened about some of the symptoms of mental illness. They're not enlightened about some of the symptoms of mental illness. Instead of them to direct appropriately or refer appropriately to a specialist, they keep on treating something different, thinking that the physical complaint of that patient could be a medical condition, not knowing that some of them they are mental illness. So all these factors put together make it not loud enough.
Wow.
Then, still other.
Other factors.
Then also this has led to a better lack of mental health insurance scheme. And most patients are relative engage in out-of-pocket treatment, making most of our patients so poor, and then there's this social drift in the sense that people have exhausted their source of income, in treating this condition, and then they are rendered useless in terms of social status. And you see some people living in Banana Island before, now living in somewhere in Adegule, because they are drained financially because of the treatment of this condition, and they can even worsen their condition when they don't have money to take care of themselves.
Is it expensive to see a psychiatrist?
Well, I don't think it's expensive if the appropriate policy is put in place by the government. As at today, as at now, the appropriate policy on mental health has not been passed. The mental health policy or bill has not been passed. So, and if this has been passed now, it should at least there should be some monetary aspects put into it, and then professionals will be accredited. I think facilities that will be accredited facilities for the treatment of mental illness, and then also the issue of mental health insurance can be put in place for people to benefit from the treatment of this condition.
COVID-19 has been a huge struggle for everyone, and also being a Nigerian, the NSAS protest has added to the complexity of living. Would these two events have affected the mental health of Nigerians? Would the two events, the NSAS and the COVID, do you think would have affected the mental health of Nigerians?
Yeah, the first question I will ask is that what is mental health? What is mental health? If you are able to understand the definition of mental health, you will see that these two entities can affect mental health. Now, I would like to define mental health for you. See, mental health is a state of wholesome well-being, accompanied by a degree of happiness, satisfaction, under condition acknowledged by the generality of the other members of the community as normally justifying a degree of happiness and satisfaction felt by the individual. So when we have all these things not in place in the society, not the environment is not conducive for people, it's not satisfying, and then also there's no joy, there's no happiness, there's no source of joy and happiness in the society. Definitely this can cause it can cause mental illness in an individual. So definitely COVID-19 has contributed a great deal. COVID-19, which is a global pandemic, a pandemic health issues, public health issue, has dealt a blow with people in the society in terms of, one, individually, people not having the condition at all, the condition of COVID-19. Just by mere hearing of people
Anxiety.
kind of anxiety. We call it in psychiatry worried well. They are worried unnecessarily, whereas they are well. They call them worried well, which are gamut of symptoms of anxiety. They just present to the hospital with symptoms of anxiety, thinking that they have COVID-19. And after running through some tests, you find out that nothing is wrong with them. It's just psychological. And then also, some people say under the individual influence, people who may have contacted the condition themselves, the COVID-19 themselves, they have all forms of worry too. They are anxious too.
Right.
What will be the outcome of this condition? Am I going to die?
Am I going to get it again?
Am I going to get it again? So all these things put together can cause anxiety, can even cause depression in them. People with pre-existing mental illness can even trigger their condition. You understand? And then also, still part of individual level too, people that have relatives that have gone down with the condition of COVID-19, they feel so sad about them. They are anxious, they are sad, they are depressed because they don't know the outcome of their relative. Even themselves, they are worried whether they've contacted it or not. So all these things put together can cause one form of mental illness in an individual level. Also, the
NSAS protest.
The still under the COVID-19.
Oh, okay.
As a result of lockdown effect of this COVID-19, which has dealt a great deal with the economic situation of the society. People have lost their job. Those that have lost their job know what the outcome will be. They are sad. They come down with depression. Some come down with anxiety. Some with pre-existing mental illness can even relapse because of financial constraint to
continue.
To procure medication or treatment generally. They are relapsed. And people finding it difficult to access the hospital during lockdown for treatment or follow-up. So they are locked down at home and then they are relapsed. So all these things put together can cause mental illness. And then also the NSAS. See, people find from the easing of this COVID-19, people are not totally or fully recovered from the economic hardship or effect of COVID-19. They are still trying to cope with the economic status of the society. And then you see people being harassed, by the police in the society, people going on their own to face their work, being harassed by them, being extorted by the police. Definitely, this can cause a form of anger and frustration on people in the society, which is a form of emotional issues, emotional problem or mental illness, which can even lead to people revolting and then protesting, which I believe led to this issue of
hashtag, yeah.
You understand? And then also the aftermath of the NSAS now, the massacre that took place.
Right.
People that witnessed the scene, the scenario, can come down with acute stress reaction, adjustment reaction, which is a form of anxiety disorders, and then also PTSD, post-traumatic stress disorders.
Yeah.
Having witnessed a traumatic experience, having witnessed a traumatic experience, having recurrence of this experience flashbacks and then presenting with some form of a post-traumatic stress disorder.
So, doctor, how can we improve our mental health? How can we now improve it already? If we say that we already have these mental health issues, how can we improve it? How can we make things more better, more softer, more
Yes, like I've said, advocacy, mental health advocacy is very important in our environment, because we are in an environment whereby we have serious mental health illiteracy. People don't have an idea at all of what mental illness entails. They go to spiritualists to seek intervention instead of going to the hospital. Like I said, public enlightenment is very important, starting from the grassroots level, from children to the religious settings, religious setting, and then also to the
social media and
to the institution of various level, to the marketplace. So one should try to enlighten them as simple as it is, as to go didactic enough for them to understand what the nitty-gritty of what a mental illness entails, for them to be able to present in the hospital on time, and then to also make them to demystify what mental illness is.
It's about.
Yes, it is. This condition is treatable, and they should seek the treatment on time before it becomes complicated, because a prolonged mental illness can become complicated after some time if they don't present on time. So, and then also at the governmental level, the government should be able to pass a mental health policy and bill on time for people to be able to access this access the treatment easily without having any difficulty at all. You should be able to pass the mental health policy and bill on time.
So I have a last question. Do you think we have enough psychiatrists in Nigeria? Because as our 2019 report says, we have 190 psychiatrists in the country of over 200 million. Why is that?
Yeah, you see, which also buttress what I've been explaining.
Right.
That's if this mental health bill is passed,
right,
there will be enough funding in training professionals, accredited professionals, and then also funding in establishing an accredited institution or mental health institution. So if all these things are put together, there will be enough specialists or psychiatrists on ground to treat patients. Because since this policy or bill is not being passed, definitely you will have that
limited
of psychiatrists in managing mentally ill patients. And then we have a lot of brain drain nowadays. The healthcare system is not well funded, the salary is poor, people that most psychiatrists have traveled out. There are enough brain drain because they are well taken care of outside. They're outside the country. So it should be funded.
Thank you so so much, Dr. Adetiloye. I'm really happy that you are here and you helped shed light to mental illness situation on my podcast. Thank you very much, sir.
Thank you so much for having me.
So that was Dr. Adetiloye. He is the senior medical practitioner in the Department of Psychiatry in Lassos. Oh my God, that conversation was so good, guys. Mental illness, mental health is important. We all have a role to play. We all should seek help. Listen, if you are having any sort of mental illness, listen to me right now. You are not alone. We have millions of people all over the world who are suffering like you are. And we don't want you to suffer for so long. We don't want you to suffer again. Please seek medical help. Don't go to your churches. I mean, it's good to pray, but work. The Bible says pray and works together. I think that's correct. Yes. So that is it on today's episode of Memoir of a Naija Girl. My name is Helen. Follow me on social media on Instagram at helen.love.23. And this video is on YouTube, guys. Memoir of a Naija Girl. Please subscribe, like, comment, share. Share with everybody, your friends, your enemies. Go on. Share. Just share. Thank you very much. God bless you.